Okay, hello. My name is Naomi Taylor. I am an official at Bectu. I cover the art technicians branch in London. We're just going to wait maybe like a minute or two just to make sure everybody's come in to the session. So we're just going to wait a little bit. So get your biscuit and tea and get ready. Okay, I think we've got, I think it's sort of stabilized. There's still people coming in, but there's a fair few. So we've got quite nice attendance to this today. So as I said before, my name is Naomi Taylor. I work at Bectu and I work with various branches, but one of the branches I work with is the London Art Technicians. But I also work with some of our independent art galleries in Bectu, like the Southend Gallery, the ICA, Serpentine. So I am hosting this chat with Sarah Titheridge, who is on the Art Technicians Branch Committee, and also Phil Wilson Perkin, who's also on the Art Technicians Branch Committee. And we wanted to have this opportunity for Chris Warburton, the prospect Bectu Health and Safety Researcher, to fill us all in on what a possible return to work may look like in this COVID-19 world, because we know that some people are being asked to go in. So I will pass this over to Chris, but if you have any questions throughout, then just pop it in the Q&A box at the bottom. We'll be looking at the chat, but I recommend you put it in the Q&A. Just go to the bottom of the screen, a bar will pop up and click on Q&A and you can put it in there and we'll field your questions. So I'll pass it over to Chris.
Thank you. Hello, everybody. So what I'm going to do, I'll probably talk for about 20 minutes. I've got some slides. And I'll kind of, what I'll do is I'll kind of take you through the information that we've got on our website. And perhaps because not everybody has, suddenly health and safety is in the headlines in a way it never usually is. So I'll kind of give you a bit of a grounding, a bit of an understanding of the law and how it applies to coronavirus, to reducing the transmission. And we'll go through some things about what that might look like in practice. So the kind of first thing to say, I guess, about health and safety law is it's a kind of principles framework. So it's not a rights-based framework. So you don't necessarily have a right to work in a safe workplace, but your employer has an obligation to manage risks. So it sets goals that employers, that engagers have to try to have to meet, basically. And I'll kind of take you through what that looks like in practice. In some respects, that's quite difficult because there's no rule book. There's no well, there is now from the government, but there's no pre-existing guidance or information about how to manage the risk of transmission in workplace context for a virus on this scale. So kind of what we have to do is we take the principles in health and safety law about managing risk. We take the science from what we know about it, from about coronavirus, about COVID-19, and we kind of build a framework based on those two things. So in a sense, this is kind of best practice, but this is what we would, this is obviously what the union is recommending, and this is kind of like, what managing the transmission would look like in adherence with the law. Needless to say, if you've got any concerns, speak to your rep where you have them, speak to the union. And we've also got a member contact center, so speak to them if needs be. Our guidance is largely fairly similar to the guidance published by the government that was published a couple of weeks ago. Where it differs, I will highlight where that differs. And throughout lockdown, we've had members kind of, across the union going into work, continuing to work, and we've built up quite a good idea about what works in that time. So we've drawn quite a lot on that. I think it's needless to say that returning to the workplace is going to be a significant source of anxiety for many people. And if we think about a different if we think about stress and what can cause people stress at work, we can kind of see there are a number of issues at play here. So, for example, a big source of stress for people at work is change. How is change managed? That's obviously an issue here. The degree to which people feel safe about their working environment, that is going to be at play here as well, and the extent to which people feel they have a say and have control over their working environment, and that's obviously could be at play. So it's really important that employers, that clients, that engagers are transparent about how they are going to manage coronavirus. And partly to that end, the government has said that employers have to publish their coronavirus risk assessments on their website. So that should help address that, but it really needs to take into consideration the expectations, the input of employees, and others as well. So I'm going to try and share my screen. Okay, hopefully you should be able to see that. Okay, so this framework, this is a framework, the Health and Safety at Work Act, has kept people safe for decades, really, and it's the principles in which we base our guidance and the principles on which employers need to approach this. And when I say employers, I mean that in the broadest sense, like businesses. All businesses, all employers need to kind of adopt this framework for keeping people safe. It's the Health and Safety at Work Act is a legal underpinning of the health and safety legal framework, and it contains a really wide set of fairly broad and general duties that apply to a range of kind of actors in the workplace. So obviously that could be employers, that can be employees, could be workers, designers, manufacturers, importers, and so on. The main duty holder is the employer. So the kind of principle, the core of it is this general duty. It shall be the duty of every employer to ensure, so far as is reasonably practicable, the health, safety and welfare at work of all his employees. And there's very, very similar provisions that apply to non-employees as well. So it shall be the duty of every employer to conduct his undertaking, note the slightly archaic language, in such a way as to ensure, so far as is reasonably practicable, that persons not in his employment are not exposed to risks to their health and safety. So that can include freelancers, that can include temps, that includes members of the public, and so on. So as well as this very kind of general duty, there are some specific duties as well that are relevant in terms of COVID, providing safe systems of work, providing adequate welfare facilities, providing adequate information, instruction, training, and supervision, and consulting on health and safety matters. So you notice that this kind of general duty contains what appears to be a fairly vague requirement that employees have to take steps to reduce risk so far as is reasonably practicable. Don't get too hung up on this, but I'll kind of quickly run through what that means. So it kind of sets a goal for employers. It sets a framework for them to kind of to aim towards. It kind of recognizes that the risk can't always be removed, but they have to reduce it as far as possible. And it also means that this, phrased in this way, it applies to pretty much any environment, any circumstances, any business operation, and any risk. It also means when it's phrased in this way, it kind of recognizes that that employees don't hold all the cards, that employees don't know all of the answers. And actually, it's the people on the shop floor, it's the people on the ground who do tend to know a lot about the risks that people are facing and how they should be managed. And this is one of the reasons why employers must consult employees. Is kind of one of the main consulting workers is one of the main requirements of the Health and Safety at Work Act, and our whole kind of framework of health and safety is designed in such a way as that that employers have to consult the workforce with the aim of reaching a satisfactory arrangement. Reasonably practicable kind of basically means that the employer has to make a calculation of the risk on the one hand and the sacrifice it takes to remove that risk on the other. And it's only when the sacrifice in terms of time, money, or trouble is in gross disproportion to the risk that they don't have to take those steps. So it's a kind of wordy way of saying that the presumption is always in favor of the employer taking steps to reduce the risk, unless, so for example, an example that's used quite a lot is, an employer spending £1 million on stopping someone getting a bruised knee. That wouldn't necessarily be reasonably practicable. What would be reasonably practicable would spending £1 million on stopping a chemical plant melting down, or something like that. So it's kind of recognizing that kind of balance, that equation, basically. Obviously, the union, we may not agree on with the employer on what is reasonably practicable, and so it implies some kind of bargaining arrangement. There's some kind of negotiation, and that's partly why the employer needs to consult on these matters. So the process of working out how to reduce risk to the lowest reasonably practicable level is the process of risk assessment. So the risk assessment for returning to the workplaces will be really, really important. This is the planning process for how to do that and how to do that safely. And this is recognised in the government guidance, and the government guidance does also recognise that employers need to consult workers on the process as well. It must be done before people go back to the workplace too, and before people are exposed to those risks. The risks have to be managed before people go back into the workplace. So this only applies to employees. Only employees can be safety reps under the safety reps and safety committees regulations. But we have this thing called the Brown Book, which is basically guidance for employers on consulting employees, consulting trade unions. Sorry, and the Brown Book says that seeking the views of employees and their health and safety representatives who have practical knowledge to contribute will help ensure the employer takes account for relevant information. And basically, to cut a long story short, does the risk assessment properly. So a risk assessment is a systematic process of establishing what can cause people harm at work and taking steps to prevent that harm from occurring. This risk assessment will establish how the employer is to stop coronavirus being transmitted between people. With COVID-19, this will be a process probably of working out the areas or the activities which will lead people coming into contact with others and taking steps to prevent that from happening. So when I say areas, I mean spatially in a workplace, what physical areas of the workplace might cause people to come into close contact with other, and what activities that people will carry out. So some methods of controlling that risk will be more effective than others. This is known as, in kind of technical jargon, this is known as the hierarchy of control. It simply recognizes that some methods of reducing risk are more effective than others. By its nature, if you can remove the risk, that is going to be the most effective way of reducing risk, because there won't be a risk. But other things like having some kind of guarding on equipment is going to be more effective than giving someone a procedure on how to use a dangerous piece of equipment, just by its very nature. So what we need to be doing, and certainly what the union is doing where it's engaging with employers, is pushing them to adopt the most effective measures possible, and measures that protect more than one person, because that is more effective as well. And that will help get risk to the lowest level reasonably practicable. Usually you'll find that more than one method of controlling the risk will be needed, and that's because all protections, any kind of protection that we could have to control any kind of risk, will only ever be partially effective. It will never be entirely effective unless you're removing the risk altogether. So the way we get around that is we have multiple controls, multiple defenses in place, and that will improve their effectiveness. So when thinking about infections in the workplace, the process of infection is often represented as a chain. So you have the source, the transmission, and the host. And breaking a link in the chain at any point will control the risk of transmission. So this is really useful for bearing in mind for yourself, keeping yourself safe when you're out and about or in the workplace. But this is really important for employers, for engagers, for businesses to think about how they are going to control the risk of transmission. So if we apply this model to coronavirus, the source is respiratory droplets from someone who has the virus, not necessarily the person themselves, but the respiratory droplets. The routes of transmission are airborne transfer of the virus, or people coming into contact with contaminated surfaces. So that could be people, clothes, PPE, door handles, all sorts of things. The host in this context is the eyes, the nose, and the mouth. Droplets carrying the virus can enter the body through the mucous membrane. So potentially the eyes, but primarily the nose and the mouth. And so what the risk assessment needs to do is to establish how to break this chain of transmission. So as I've previously said, the most effective way to control the risk is ensure that there is no risk, if that's possible. For a long while to come, I imagine that there could be guidance from the government that anyone who develops symptoms, and there are now 3 symptoms, will need to self-isolate at home. An important element of removing risk will be ensuring that where people can work from home, that they continue to work from home, unless there's an essential reason or just by the nature of their job, they must be in a workplace. And the government guidance acknowledges that this is going to be in place for quite, well, it doesn't offer an end date, so it's going to be like this for a significant while, I think. An important element of this is that there's 2 high-risk groups. So there's people who are shielding, who are classed as, in the guidance, as extremely clinically vulnerable, and people who are just clinically vulnerable. So the shielding people have been asked to stay at home for 12 weeks, and I think that's actually going to be coming to an end in a few weeks' time. So we're waiting to hear what the next advice is from the government. But those people are being asked basically to stay at home for 12 weeks and not go out. And also the other, the kind of clinically vulnerable people are being asked to pay particular heed to physical distancing. So where Prospect's been speaking to employers, where Prospect Bectu, I should say, has been speaking to employers, it's been really about ensuring that there are procedures in place to now allow these people, to protect these people, basically to ensure they can work from home where at all possible. And where that isn't possible, some kind of mechanism so they can work from home or stay at home on full pay. It will be important during this period to think about what tasks need to be carried out. And obviously, if you don't carry out particular tasks where possible, then that would reduce the risk of transmission, because you won't have people coming into work or coming into close contact with each other. Obviously, some things you can delay in the short term, but the longer you delay them, the more necessary it will be to carry them out. So an important element in determining whether this is appropriate is thinking actually about whether risk can be appropriately controlled. But obviously, it's a factor. You know, you do the work that needs doing. If it doesn't need doing, then you consider about whether it can be delayed. And finally, on this section, just wanted to touch on as well, there'll be a requirement at pretty much every workplace that employees have to provide hand washing facilities. Where it isn't like a remote workplace or a temporary work site or something like that, then employers, engagers will need to provide hand sanitizer where the washing facilities, the welfare facilities aren't available. And it will also be important to give people information about how the virus is transmitted, reminders to wash hands, and so on and so forth. So all of this to a certain extent, and some more of the points in the slide, will ensure that people who are carrying the virus can't pass it on to people outside their household. However, there is evidence to suggest that people can carry the disease asymptomatically, which means they can spread the virus without necessarily knowing that they're infectious. And those who do develop symptoms often don't show signs of being infected for around 5 days. And a significant portion of infections can happen in this period, particularly the 2 days before people go on to develop symptoms. So other measures will be needed as well. That's just part of the picture. And a significant element of this will be about maintaining physical distancing, which will need to be maintained for probably quite a considerable period to come, I think. So it's important that there's ensure there's a gap of 2 meters wherever possible between people. And this is because, as I've kind of alluded to, coronavirus spreads through transmission when an infected person coughs or sneezes, and they cough or sneeze small droplets of virus into the air. And obviously this is more likely in close contact. So thinking about maintaining physical distancing, there's probably 2 elements, as I've said. Need to think about the employers, businesses will need to think about the physical, spatial layout of their workplaces and the tasks that people carry out in those workplaces. And they'll need to make changes to both to enable staff to maintain physical distancing. So when thinking about spatial organisation of a workplace, then particular attention will need to be paid to thoroughfares, areas where people congregate, such as any reception areas, canteens, things like that, corridors. And they'll also need to think about how many people are in the building at any one time, because if too many people are in the building, it'll make it more difficult to maintain physical distancing. So some examples, what might this look like in practice? So segregating flows of foot traffic potentially. So maybe having one doorway to access the building, having another doorway to exit the building, having separate staircases. So one staircase for going up the building, one staircase for going down, restrictions on use of lifts. So maybe going up in the lift and coming down the stairs, something like that. As I say, having fewer people in the workplace, perhaps through having staggered shifts or something like that. Where there are workstations with computers or other types of workstations, ensuring that they're sufficiently spaced out to ensure that people can maintain physical distancing. If there is computers, restrictions on the use of hot desking, returning to fixed workstations, and potentially erecting some kind of barriers or screens between people. And this is perhaps particularly relevant in areas where there is interaction with the public. So on reception areas, ticket desks, things like that. So kind of tasks. So some tasks by their nature will require people to come within 2 meters of one another. So employers, businesses will need to think about how people carry out these tasks safely while maintaining 2 meters of separation. So it might well be, hopefully it should be, that tasks can be kind of planned and sequenced in such a way as to allow social distancing to be maintained. Sometimes it can be quite complicated, but I've seen some, for certain parts of the union, I've seen some really, really good detailed procedures around certain tasks that kind of break it down and think through in really good detail about how to approach a particular task while maintaining physical distancing. And our guidance is that where that can't be maintained, where it is just impossible to maintain that physical distancing, workers will need to be provided with PPE, basically. But I should say that priority should always be given to maintaining physical distancing, because that is going to be much more effective than RPE, PPE. So PPE, sometimes I say RPE. RPE means respiratory protective equipment, so that's masks. The more general term is PPE. So where it is not just physically not possible to maintain physical distancing during the task, then our advice is that people should be given fluid-resistant surgical face masks. Now, these offer a higher level of protection than probably things, the masks that you see, most types of masks that you often see people wearing outdoors. These are fluid-resistant and they do prevent viruses going through them. They will reduce people's exposure, and it's not just a mask to prevent people passing it on to others, it will reduce people's exposure. So these fluid-resistant surgical face masks are often called type IR or type IIR face masks, and that all that does is indicate that they're fluid resistant and been certified as compliant with a particular European standard. So you can get disposable half mask respirators as well, which are sometimes known as FFP2. You can get FFP1, FFP2, FFP3. FFP2 and FFP3 should provide a higher level of protection than surgical face masks. And these might be needed particularly in circumstances where people are going to be working alongside each other for extended durations. So if face masks are introduced, they really must be introduced alongside other measures to control the risk of transmission as well. So that could be things like thinking about, well, do any shared tools? Well, can we stop tools being shared? Can we give everyone their own set of tools? Can tools be cleaned if that's not possible? Things like that. So it shouldn't be just PPE, RPE, and nothing else. It must be alongside other control measures too. So this is one area where the Prospect Bectu guidance differs with the government guidance. The government says that that employees are not required to wear RPE where they can't maintain 2 meters physical distancing. The only settings they advocate for this, for the use of RPE, is in healthcare or to deal with risks that you may come across as part of your normal work as opposed to COVID. So to protect you from dust or to protect you from chemicals or something like that. So it may be the case that there will need to be some kind of agreement reached with the employer where we have recognition. There may be some kind of some kind of discussion that we have about the employer about this minimum level of protection. And the reason that we've diverged from the government on this is because it's entirely consistent with this idea that I talked about earlier of getting risk to as lower level as is reasonably practicable. It is clearly reasonably practicable. You would have masks to protect against other health conditions where you can't control the risk in other ways. And there's evidence to suggest we know it works, so why wouldn't you do it? However, that's not to say that there aren't caveats with RPE. It's at the bottom of, remember I talked about the hierarchy of control, it's at the bottom of the hierarchy of control. And that's basically because if it isn't used correctly, it can introduce more risks. And for it to be effective, it's important that people are trained in how to use it. And that includes how to put it on and take it off without cross-contamination. It needs to be compatible with any other forms of PPE that are being used. It needs to be compatible with people who are wearing glasses, compatible with people's glasses. In the case of FFP2 and FFP3 masks, they need to be face fit tested. And that's to ensure you can't have any stubble or anything like that, like I've got at the minute. They need to have a really tight seal around the face, otherwise they won't work in the way that they are meant to. And that's pretty much everything. Just to touch briefly on transport. Obviously, there's going to be, if all of these things are implemented in a workplace, then probably people's greatest risk would be on transport. So businesses need to be thinking about how to reduce employees and workers' reliance on public transport. There's a few ways to do this. Obviously, working from home is going to be a part of that. There may be some other elements around providing extra car parking facilities where that's possible, providing additional cycling facilities, maybe introducing staggered shift patterns and so on. So it's the Prospect website that this goes to, but if you put in bectu.org.uk, this will work as well, and this will take you through to the coronavirus hub that we have that provides loads more information and advice, not just on health and safety, but on other issues as well related to coronavirus, whether that's job retention scheme, legal Q&As and everything like that. So do go and have a look. So thank you. All right, we're happy to take anybody's questions now.
Okay, so are there any burning questions you've seen, Phil or Sarah, that you wanted to put forward first?
Yeah, there's a couple. Some of them are sort of touching on issues that have been raised in the Q&A, so maybe we should do these first and see if that clears it out. People are asking what legal rights do full-timers, freelancers, casuals, 0 hours have if they feel unsafe on a job, and how they should deal with that. Also, what support will they get from the union and what steps to get that support?
Well, shall I talk briefly about the protections that the law offers? There is a law called the Employment Rights Act. This is a piece of employment law, so there is more information on the website about this. Employment law, we do have lawyers at the union. It's not necessarily my area, but suffice to say that there is a requirement. There is provisions in the Employment Rights Act that say that if people are reasonably believe they are in serious or imminent danger, and they can't be expected to avert that danger, and they can basically withdraw themselves from place of work. However, that needs to be really heavily caveated because it's well, the right is that if they do that, they can't be subject to detriment or dismissal. However, the right can only be enforced in an employment tribunal. So obviously you've got to have been subject to detriment or dismissal, and then you've got to take it to the employment tribunal. And there are a number of challenges there. You have to demonstrate that the dismissal or the detriment was a result of taking this action, which might be quite difficult. They will consider all the factors of the case, whether the belief was indeed reasonable, whether it was truly held, the extent to which the employer was following official guidance, and particularly if this is around RPE. Remember I talked about the government advice saying that you don't necessarily need to wear RPE. So if that is the basis on which you withdraw, that's going to be really difficult to argue in an employment tribunal. So I think our first message is that the union obviously will protect you. We use the law robustly where we need to, but it's always best to resolve issues collectively wherever possible, so that people aren't in that position. The other thing to say is that that law only expressly applies to employees. There isn't such equivalent provisions available for freelancers, unfortunately. I think I saw this is slightly stepping outside of my area, but I think the law on which it's based does apply. It comes from Europe, and it does apply to all workers, I think, rather than just employees. It's the way it's been drafted into UK law that does make just reference to employees. So there is the potential that it could be taken on behalf of a worker, but again, always seek advice beforehand, because there's no guarantees with this, unfortunately.
Yeah, because someone has also said, can agency personnel be dismissed if they refuse to return to the workplace when they can work from home? And that's kind of falls into the same stuff, doesn't it?
Yeah, I mean, I think I would say that with that kind of stuff, you'd have to look at it on a case-by-case basis in terms of what their employment status actually is. But I think what I would strongly say to everyone, particularly in current times, I mean, I know that we're all, there's lots of people who are dealing with serious financial issues, but I think genuinely, if you genuinely think there is a threat to your health, then I think, just as you wouldn't enter a building if the whole thing was like electrified and you knew that it was very dangerous to be in there, like really genuinely think about that and put your safety first, because we'll help you if there's a problem, but the protections for people outside of being an employee are not as good. They're based on EU law, but I still would strongly say, think about your safety first. Don't be afraid to say this is not safe. Are there any questions that are coming in? Are there any questions that you want to ask Sarah, or any other questions that are coming in that you think we should be on?
Well, there's quite a few about just, because we're covering quite a few industries in this webinar. So without getting into specifics of jobs, but essentially people that are working in really close proximity with other people, where social distancing can't be maintained. Chris, you did touch on like the sort of protective things you could wear, but in terms of like surgical masks and stuff like that, I mean, there's a lot of confusion as to what really covers you in terms of masks and things like that.
The no RPE will protect you completely, and this kind of links to that kind of layers of protection I was talking about previously. So the FFP3, which I talked about, if it's fitted properly, will have a minimum protection factor of 20. So it will reduce, usually they have more, but will reduce whatever you're breathing in, the virus, by around 20 times. FFP2 around 10, and surgical face masks, there was some research from the HSE who suggests it's about 6. So all of these things will reduce the risk. I guess the issue is that that there is no point at which there is no risk. It's the steps that we can have, multiple steps we can put in place to reduce the risk to a point where it's kind of as low as is reasonably practical or insignificant, and we don't have to, you know, worry about it too much. But it is about yeah, as many steps as possible. And the other thing I often see is gloves. Often people wear like nitrile gloves, and while they are going to be only marginally more effective than not wearing gloves and washing your hands, and the reason they're only marginally more effective is because it might discourage people from touching their face, because you've got a blue glove on your hands and it might seem a bit odd somehow. Because you can still pick up the virus on your gloves, you can still transmit it from place to place on your gloves, you can still touch your face and transmit the virus in that sense. So it's only as effective once you've taken it off, you know, so that's only as effective as washing your hands, if you see what I mean. So, but I appreciate that there's a kind of reassurance at play as well, and people, you know, might feel a kind of degree of reassurance if having these things on and in place.
Just to cut in, I've got some polls that I'd like to run with the attendees on this webinar. If you can, I'm just going to launch this. We'd like to ask you, do you feel safe returning to your workplace now? So I'm going to launch that, and if you just go down to the bottom of the screen, you can click on polls and you can give your answer yes or no. So all the answers are coming in. It's just like Eurovision, it's very exciting. Okay, so 70% have voted. Okay, almost there. Oh, yeah. Okay, I think about 10 people have gone to get a cup of tea, but I'm going to end the polling at 84%. So just to give people an idea, we've got about 140 people on this call, so we'll just end the polling there. Okay, so we've got 75% of that group said no, they don't feel safe returning to work now, which I think probably reflects how a lot of people feel about returning to work. I mean, we've got sort of people asking specifically about like what kind of things do people need to put in place for like art galleries themselves. I mean, is there anything particular, Sarah or Phil, that you want to put in terms of like art handling? Like, are there concerns that are there for art handlers specifically?
Well, we've had a couple of questions about working abroad and shared equipment and shared tools and vehicles and things like that that could actually help people in other parts of the industry. One question was looking for advice on working abroad regarding health and safety with touring exhibitions and art tech work, how this could affect travel insurance and what contractual cover to ask for if they became ill.
I mean, is there anything you want to say about that, Chris? I can take it if you.
I'm not familiar with insurance, I'm afraid.
I mean, my general feeling at the moment is I would wait and see what happens, because my understanding at the moment is that a lot of travel insurance insurers simply aren't insuring for COVID-19 as it currently stands, because we're still on lockdown. That may change, but I wouldn't recommend, if you can avoid it, booking any trips without travel insurance, and I don't think you are physically able to insure yourself for COVID-19. And if you were going to somewhere, say like the States, that is going to be a really expensive bill if you find yourself there. I mean, to be honest, I'd be kind of impressed if you did manage to get into the States as they currently stand. But as things come out of lockdown, I think be cautious and make sure you've read the policy, because I think a lot of them are going to try and avoid covering people for these things as it currently stands. I mean, I was more kind of thinking about, are there any kind of specific questions coming in specifically about art galleries and how people work in those spaces and what they need? Is there anything coming in on that?
It's mainly about PPE.
Okay.
So I think it's probably, you know, worth saying that if you're these are kind of general principles, and try and, you know, in which you can apply to a range of circumstances. So they should apply to all situations. And if you're doing any kind of task that you're doing as an art handler, it should be, if you're a freelancer and you're doing it, then, and you're doing it alongside other people, then the law says that as a duty holder, you need to kind of cooperate with the person that you're working alongside. So have a conversation with that person on the phone or via Zoom about how you're going to approach this. Think between you about how you were going to address, how you were going to maintain physical distancing where possible. It may be that if the particular task that you're doing, you can kind of plan it out in such a way as to ensure that you can both, or if there's more than one of you, you can all ensure that there is appropriate physical distancing between you. But if you speak to each other and you decide that, well, that is just not going to be possible, then yeah, think about, is there wearing some kind of face mask. And I would say a surgical face mask is probably a bit better if you're a freelancer, because it will provide a similar level of protection to other types of face mask, but you don't have to worry about face fit testing and stuff like that. You do have to worry about how you take it on and take it off appropriately, but there's information on the website, on the internet, about how you could do that as well.
There's a question, because there's a lot of what we do is we're working obviously very closely with each other, but quite often we'll be in small spaces or vehicles. So sharing a vehicle transport at work, but then you have to then go into somebody else's home. I mean, this is obviously, if someone's working for a company, they're just employees. They should be sorting that out, I would have thought, and like coming up with that. But then there's obviously lots of people who run their own businesses that or freelance that are going into those situations. So how can you kind of handle that?
So I think that I mean, even if you're working for an individual in a private capacity, or if you're working for like a small business or something like that, if you're doing it in a private capacity, the person wouldn't necessarily have responsibilities under health and safety law, but you know, I think it would be worth speaking to them about the arrangements that they've got in place. Speak to them beforehand when you're discussing the contract, probably, I guess. And, you know, think about, are they going to provide you with enough physical distancing while you're doing the task? Are they going to clean the area that you're working in beforehand? And think about beforehand maybe whether you want to take some kind of hand sanitizer with you or something like that. If it's like some kind of small business, then they should be thinking about how you know, they've got an obligation under the Health and Safety at Work Act to ensure that non-employees are protected. So they should be thinking about these things as well. And they should be thinking in a similar way to the guidance that I've kind of talked about, how they take steps to prevent people transmitting the virus. So I guess, again, you know, speak to them beforehand, find out about their arrangements. And if you're going to work with anybody else, any other freelancers, speak to them too about how you're going to do it together, I think, if possible.
There's a question that's come up just about transmission of the disease. Say you yourself has it, you then transfer it to someone on the job. Is there any legal, can they come back at you at all with any legal?
I think
I mean, that's a pretty tough question.
I think this is kind of unprecedented, you know. We never really have kind of happened in quite a way like this, but I think the answer would be no, because it would be virtually impossible to establish actually where you got the virus from. You could have got it from anywhere, really. So I think, in short, no. You couldn't be you couldn't be prosecuted in a statutory sense. So obviously you've got common law under which you can be sued, and statutory law under which you can be prosecuted by the state. And I don't think you could be prosecuted either. And frankly, I don't think the HSE would even have the resources, or local authorities, which are the main two enforcing bodies in health and safety. They don't have the resources to even consider things like that. So I don't think you need to worry about that.
Risk assessments. So you mentioned about that employers should be publishing their coronavirus risk assessments on their website. Should that be internal, so like intranet, or external, or indeed both?
Probably both. So this is only guidance. This was something that the TUC was pushing for, and it's really a kind of additional measure to ensure that the communities, any kind of contractors working for these organisations, have additional assurance that they are taking matters seriously. I think the TUC wanted it to be mandatory, but it is just voluntary. But if you are, you know, if you're, you know, you and your other members in a workplace, I think it's well worth pushing your employer to do. So yeah, so it's on its external website as well. But I think as a good practice measure, everybody who works for an organisation should be told what the findings of a risk assessment are. So I think that those need to be shared with members of staff.
I mean, this is it has really shown up the fact that we don't actually do risk assessments. So I'm freelance, have been for quite a while. I work in multiple institutions. I don't think I've ever seen a risk assessment anywhere I work, except for maybe one place. And then I have never done any myself for any of the private work that I do. So where would be a good place to get examples of maybe risk assessments, like templates and stuff, and also like the most kind of like up-to-date scientific evidence on transmission rates and infection rates and things like that?
I think there's various templates floating around, though I think some, frankly, if you're like a sole trader or, you know, freelancer or something like that, kind of overcomplicate matters too much. So focus on the control measures. You know, there's all sorts of information. You can get really into the weeds about evaluating risk, taking severity and likelihood, and some risk assessments out there will take you down that route. But focus on the control measures, focus on what steps you are taking. Don't worry too much about the kind of mathematics or statistical probability of it. There's some templates on the HSE Health and Safety Executive has templates, risk assessment templates on its website. They're not COVID specific. They're fairly general, and they should be able to kind of fill those in as you go along with the guidance, the generic guidance on risk assessment provided by the HSE. There's an equivalent body in Northern Ireland, actually, which basically has essentially the same laws as the UK, the rest of the UK, I should say, and that they have COVID-19 template risk assessments. And there's also some another one from the Chartered Institute of Personnel and Development. They've got a kind of template risk assessment as well.
Can I just?
No, go on. Sorry. Yeah.
I was just going to say we wanted to. There's one more poll that we wanted to do before we do some more questions. I just wanted to know. So the second poll we wanted to do was returning to work, because I know a lot of front of house staff in art galleries, conversations starting to happen. I know a lot of art technicians have already gone back to working in some spaces. So what I wanted to know was, have you been asked to return to work yes or no. So I'm going to launch that poll now. Yeah, so while we're waiting for that to complete, a question that I thought was kind of interesting that's come up is, would you be able to say something, I mean, this may not be one for you, Chris, but still I think it's worth addressing. Would you be able to say something as to when it would be acceptable for institutions like art galleries to open? Now, July, October? I mean, are we looking at something where the rate of transmission as it currently stands, is it technically safe to start opening art galleries, or what is the government defining as safe?
As far as I've seen, I think the plan is for July, I think, though I know that a lot of employers are developing plans as we speak, really. I think the answer is when employers have appropriate procedures in place to make matters safe, you know, and not before the government guidance said so. So you know, yeah, when the employer has done the risk assessment, when the business organization has done the risk assessment, when it's got robust measures in place that will protect members of staff and others, freelancers, when the people who work there are satisfied that they are robust, then I think that is the point at which things can reopen. I mean, obviously, this is kind of linked to, like I was saying a moment ago, you can get really bound up in questions of risk and likelihood. I mean, likelihood, when you're doing a risk assessment, you tend to weigh up the likelihood of something happening and the severity of that, and you can kind of combine them, and that gives you a kind of risk, and that guides you in what kind of measures you need to take. You know, that reasonable practicability I was talking about, that kind of gives you an idea of how kind of stringent, how much money you need to spend, how much time you need to spend addressing something. So likelihood in the context of COVID-19 is a question of duration, distance and frequency. So how often you are exposed to other people, the distance between you, how often that happens. But that's kind of like, you know, also linked to that is the rate of transmission. So there are so many variables, and so that's why I've really, you know, I think others want to encourage people to focus on what actually is happening in practice. What is happening in practice? What are the control measures? Can any more be done? And not worry too much about the likelihood. So yeah, and the R number, the rate of transmission, is part of that. So obviously the rate of transmission will vary across the country, you know, so in some areas the risk will be lower, in some areas of the country the risk will be higher. So I think you can kind of, as I already have done, go down a rabbit warren of working out risk. What matters is it safe? Does it look safe? Does it feel safe to people? And that's the point when we can start to think about opening things again.
And also, unfortunately, it's kind of down to the employees, isn't it, to really kind of challenge the stuff with management and employers that you can give all the guidance in the world, but really it comes down to what you feel safe doing, and really challenging your workplaces to see the risk assessments, to ask them questions like, if I get it and I'm working here, are you going to pay me for work that I then lose? You know, like just really, and like who's going to provide the PPE, you know, all this sort of stuff. Like, unfortunately, employers probably won't be that amazing. So it's our responsibility, unfortunately, to really push this stuff. I don't know what you guys think.
Yeah, and there are, you know, sorry,
Chris, just to weigh in with our poll, just out of it, which is kind of interesting. 88% of the people on the call, so 86% voted, 88% of those said no, they haven't been asked to return to work.
Wow.
So I think, which is kind of interesting, because I think it's not surprising to me from the art gallery perspective, because obviously they've not opened yet, but there's talk about it happening at some point. But with the art technicians, I've heard a lot of art technicians saying, I've been asked to do this job, I've been asked to do this job. So that's interesting from that perspective. But I think, you know, really it's going to be interesting about the PPE, because I mean, if you're a gallery invigilator and you're sat there all day, I mean, what is the safest thing to do? You know, do you wear a face shield? Do you wear a mask, gloves? I mean, you know, and I think it's weighing up what's the best thing to have, you know.
If there's you know, if you're not coming into close contact with anybody, if you're the nature of your job just means you don't do that, then I can't see any reason why you'd necessarily need a face mask. It depends on the nature of the task, and it should be kind of looked at on a task by task basis, as opposed to any other kind of mechanism, role by role or something like that. It should be looked at on a task basis. Yeah, and you know, I think the union across its various sectors is responding with the kind of bodies that exist, the employers' bodies that exist, and negotiating frameworks about returning to work and returning to work safely. So you know, and that's particularly one way where, you know, if there's any kind of areas of the membership where there's a lot of freelancers, I know that you know, there are kind of sectoral discussions that are happening with equivalent employers bodies, and that should provide assurance that that at least the kind of sector is geared up, has agreed to these principles, and has agreed that the employers in this body will, in this sector, will adopt those principles. So sometimes it won't necessarily be a case of individual freelancers or individual employees approaching their employer, because sometimes, hopefully, it will have been addressed at a higher level, potentially. And that's happening across the union. It's happening in workplaces. So it really is, you know, it is incumbent on us as the union, on us as members and reps and members of staff to push employers to do that. And there are different levels at which that can happen, and then there's different levels at which that is happening. And even if you're not in a position to directly do that, then speak to us, speak to your reps, speak to the members of staff, and we can represent your views in the discussions that we're having, and making sure that they are taken on board. Because we are having these discussions with government, we're having these discussions with government, we're having these discussions with employers or associations and things like that. So it's really important that we do have your information, your feedback, your concerns, so we can represent those in the forums that we need to.
Awesome. Okay, well, I think we that was a perfect note to end on. We just hit 2:30, so I'm conscious that there's another webinar soon after our one, so we need to leave the Zoom account. But thank you so much to Chris for that really useful presentation, and thanks to Sarah and Phil for manning the questions and womaning the questions. And so we'll wrap up now, but as we've said, if we didn't get to answer your question, I'm really sorry. But if you've got anything that you need to ask, you can always drop a Bectu official an email, or ask your local rep. And if you're from a prospect venue, there'll be reps and officials as well. So I take care out there, just be mindful of what's going on, and don't be afraid to challenge things if you don't think they're safe, because the most important thing is your health. So take care out there, and we'll catch up in the next webinar. Bye.
Thank you. Bye.